Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. We have great guests on today from the Connected Health Initiative. We have Brian Scarpelli, the Executive Director. Welcome to the program, Brian.
Thank you.
And we also have Caleb Williamson. He is the State Public Policy Counsel, responsible for the State Public Policy Council at the Connected Health Initiative. Caleb, welcome to the program.
Thanks for having me.
Awesome. So obviously there's a lot going on in the entire healthcare industry, and policy is key to shaping the direction of where we go. So before we get into some of the details, tell us a little bit about each of yourselves. So we'll start with you, Brian, and then we'll go to you, Caleb. Tell us a little bit about yourself, your background, and how you got to healthcare.
Sure. Thanks again, and thank you again for having us on. It's really, really great. You know, it's an interesting winding path, I suppose you could say, that took me into the digital healthcare space. My background is from another sector. I actually grew up in the commercial AM/FM radio industry. My parents are small town owner operators in the Lower Peninsula of Michigan, and originally had planned to get into the communications law space. That was kind of my original goal back when. But through working at a couple standard setting organizations and trade associations, I think that what I would think of as the Internet of Things effect, IoT effect, the idea that some use case or entire sector, vertical, that previously was not using wireless connectivity to enable more informed and real-time decision-making, that sort of thing, is now doing that, and sometimes it's being patched on, retrofitted, but, recognizing that interesting effect and opportunity, and how and over time, seeing how unique some different sectors are. And healthcare is probably the greatest example of that. Much more highly regulated than other industries, for good reason. Safety of life is very often an issue. And many sector-specific laws and regulations and frameworks, whether it's the fact that the U.S. government is the largest payer for health for services. That's extremely unique for the U.S. economy, right? That there's privacy and security rules that are in law only for certain parts of the healthcare sector. Those kind of things are an incredible challenge and opportunity. So I've been that's what attracted me to it. Coming from the communications and telecom space is the bridge that I took to the healthcare sector, and basically led to what we call the Connected Health Initiative, something like 8 years ago, which is funny to reflect on that 8 years ago. But I think there's the other thing that's exciting about it, I think that's attracted me to the space, is it's unifying. I think there's so many issues that are, you could say, partisan or divisive and politically divisive, but the idea of modernizing the way healthcare is delivered and improving the workforce experience, et cetera, while reducing costs, is something that I think brings everyone together. There's always questions about how we get it done, but across the different sub issues, and I'm sure we'll get into some of these, that's kind of been something too that kind of took me, that attracted me to the space and to the issue. But don't have a healthcare industry background, as it were. So walked in cold basically initially, which
Well,
maybe has
sometimes,
some advantages, right?
yeah, sometimes that's a good thing. So
Oh.
sometimes we need an outside perspective on how to do something, right?
Mhm.
Because healthcare can be so focused, if you will, might not be the right word, but focused in the context of, well, this is the way it's done, and sometimes you need an outside perspective to say, hey, why don't we try it this way, and see how it applies. So oftentimes people would be surprised about the results. With that, let's go over to Caleb. Tell us a little bit about yourself and how you got into healthcare.
Yeah, sure. So I guess for me, it goes back to law school, and shout out to Syracuse Law, go Orange. But in law school, I joined the Elder and Health
Good
Law
lacrosse
Clinic.
team, by the way.
Oh, incredible programs. When I was in law school, I joined the Elder and Health Law Clinic, and that was what piqued my interest. You know, you grow up and you start watching your grandparents age, and it's like, okay, well, how can I be a better grandson, right? How can I be in a position to understand how the laws are growing, how they're changing, and how they apply to potential needs that every family will inevitably face. And so I joined the Elder and Health Law Clinic when I was a second year law student,
Hmm.
and it really enjoyed my time. I was unfortunately one of the graduates who graduated in the midst of the pandemic. And so when that happened, you started seeing all of these health laws and these one-off, rare policies being implemented. But after law school, I joined the New York State Senate Majority Counsel's office, and I was providing counsel to the Committee on Health and Human Services. And that was a very interesting time to be working in that office during a pandemic. Every day was, for lack of a better term, a fire drill. Every policy that we were analyzing, everything that we were working on, we had to work at an exponentially fast level. And so for me, that was my intro into the state policy world. The passion for health has been there, but I was able to gain some experience with the legal side, analyzing some of these bills, working with the state legislature, understanding exactly what lingo resonates with them. And during the pandemic, there was an opportunity. You got to see technology boom. And
Yeah.
so I was trying to find opportunities and ways to merge my interest with state policy, my new understanding of how the sausage gets made, and how could I merge that with this increasingly relevant sector like technology, and how can I also merge my interest in health. And so fortunately, I found an organization that merges all three of them,
Well,
and I was able to build a bridge with those who I've worked with when I was with the New York State Senate, and continually build a bridge with various folks across the digital health space. And I know Brian will probably tell us more about who we are, the Connected Health Initiative.
yeah, yeah, definitely. We'll get there. So, the two of you don't really know me as well. So let me, my entry into healthcare is very similar. My father, who my audience knows fairly well because I talk about him a bit, he was obese. He had every complications to obesity, and so he was diabetic. He had cardio issues. He was at in-home dialysis, and his argument was, he's the true classic. If it doesn't hurt, I don't need to go to the doctor. But the last 5 years, it hurt. One leg amputated, second leg amputated, an arm then, and two fingers on the other hand. So I know firsthand what it takes for a family to convert a dining room to a bedroom,
Mhm.
to add a bathroom on the first floor, put a ramp down the steps, and my mother always said she was lucky to have 6 kids because she had 6 caregivers as well. You look at the state of the industry and how the resources, while they may seem to be there, if the consumer only knew, it would be better. And the cost is just prohibitive. That said, I had a father-in-law with Parkinson's, and we followed him through his journey as well. So yes, and my mother had passed the cancer. So yeah, it's if you don't have your own personal health advocate, it's hard for me to understand how some people make it through the system. So that's my passion relative to how to find innovative ways to increase the quality of care and while decreasing the costs. Right,
Mm-hmm.
that's a value statement. So the ideas, and that's why outsiders. I'm an IT guy, right? I came from UPS and was part of building out the first national wireless data network, believe it or not, back in early '90s when there wasn't a wireless data network. And so there was always innovation. I was very instrumental in helping UPS automate some of the things that they did back in the late '80s, early '90s. I'm showing my age, but back then everything that was done paper and fax.
Yeah.
So the idea of how to be innovative and transformative is really key, and that's why I was, as you know, I joined one of your conference calls, and I was compelled to actually reach out. I think it was Caleb that I reached out to, and I wanted to talk to you guys some more because of the things you guys were doing. And I think it needs to, people need to hear it and engage you guys. The organization Connected Health Initiative in a much more substantial way. So with that, let's hear from Brian. Tell us a little bit more about the Connected Health Initiative.
Sure, absolutely. Thanks so much. And boy, there's so that just thematically and from experiences myself, and so much alignment. I probably should have added too a little bit earlier that maybe part of the reason that these policy issues are so unifying in these divisive times, probably an understatement, right? Is because it really does connect with everyone. Everyone has an experience, with a loved one themselves sometimes.
Yeah.
They think, why can't it be better?
Yeah.
But that the Connected Health Initiative is, I think, as I mentioned, about 8 years old, and it's a I guess I would say a multi-stakeholder consensus approach to pro digital health policy advocacy. That's kind of some buzzwords, but I think the upshot is, I look around at I call it the ecosystem, the landscape of organizations, companies, think tanks, et cetera, that are active in health policy advocacy. And what we saw there was like a gap to step into, in a way, was someone to find those threads of agreement that run across all of the different key parts of the healthcare ecosystem. And what better, issue segment, if that's the right word, than with digital health. Because whether it's the technology developers, the healthcare providers from all different sorts of walks and different populations they're serving, the patient groups, insurers, and by that I would mean, the Centers for Medicare and Medicaid Services, but also private insurers. Everyone has an interest in responsibly using digital healthcare tools to improve outcomes, reduce costs, improve population management, and improve the workforce experience. So that was the motivation in creating this not-for-profit, entity that basically, the widget that it makes is the advocacy. There are other, organizations that everybody probably knows of that organize large conferences or have certifications that they put together and things like that. And those have super important roles. But the focus for the Connected Health Initiative has just been on finding ways to move the ball forward, whether it's at the congressional level, at the federal agency level, which is where I think the most progress has been made. Sometimes small, incremental, but progress is progress. And at the state level is something Caleb and I so often collaborate on, and I think that there's a real heightened need these days with states stepping in to fill gaps when the federal government can't move forward. And so that was the motivation. That is the motivation behind the Connected Health Initiative. Today, we have something of a, just for what it's worth, and because the question might be kind of hanging out there, is like, how do you identify those threads of agreement? We have this advisory, well, we call it a steering committee, but it's like an advisory board or other council, and other people have different names for it. But we've really gone out of our way to populate this steering committee, which is in the mid-20s organization-wise, with representation from all these different segments. And I recognize you're never going to get full as robust a representation of any particular segment as one would like to, but I think it's unique in a way, because God bless them all, but there's many a lobbying organization that are on behalf of just industry, or just the physician community, or just certain segments of the healthcare provider industry, and they should be representing themselves, and that's really important. But we're trying to include all those voices and then find the threads of agreement between them. And I have to admit that when we started this, I was a little scared. I was like, are we really gonna find a lot to agree on? But it turns out there's like I kind of previewed my own what I'm about to say now earlier in saying, yeah, there's a lot. There's a I think as the need for modernization across use cases, programs, whether it's in modernizing a regulatory or legal construct, or improving on the incentive side how something is paid for or recognized by a system like Medicare. I think these, and as costs continue to go up, sadly in some cases like a hockey stick on a graph, the need is only greater and greater, and I think it's even more and more unifying. So that is the Connected Health Initiative. Is a little bit of background about it. I mean, where the Connected Health Initiative like actually does stuff, right? Because I might sound a little nebulous as I'm describing it, but the goals are important, I guess. But there's a great deal of congressional lobbying, basically advocacy that we're doing on a range of issues, but it's proposing legislative text, responding to legislative proposals from certain committees and offices. So we're quite active on that front. Then there's I really don't want to understate how important the administration, well, the federal agency level, whether it's the administration, that is agencies that working for the president directly, or independent agencies like the Federal Trade Commission, ones that have appointed commissioners that have a mix, 5 commissioners, and 3 are right now, 3 are Democrats, 2 Republicans. So they're within their existing authority. Congress doesn't need to act to authorize them to do many things. They do need to authorize them to do some most new things, but there's a lot of room within the existing authority, particularly in areas like reimbursement, where there's incredible opportunities. There's also challenges, but so very active there. Lots of formal filings on, for example, the annual Medicare physician fee schedule, which is in a nutshell how Medicare doctors get paid for their time, and other rules. So very active in a lot of filings and in front of the agencies too, and then increasingly with state policymakers.
Let me ask Caleb, State Public Policy Council. So obviously it's state level, but I want to bring in what Brian was saying in context of federal agencies. And so there's been a recent Supreme Court announcement or decision, I should say, In that agencies basically, if I'm going to interpret it wrong, but the short answer is that state agencies can interpret. I'm sorry, but federal agencies can interpret law. That's for the courts to decide, right? Where and previously the idea was regulations from administration to administration would change to affect what the interpretation of the law, right? How does that change advocacy through your organization and other like organizations that Brian spoke about?
Yeah, thank you for that question. I think that doctrine is the Chevron doctrine that was
Yes.
just recently overturned. And for that, how does that change advocacy? I think from my perspective, it forces advocates to be more offensive, not offensive, more offensive when it comes to getting active and being proactive when it comes to pushing these kinds of conversations, but at the state level, at the agency level. I think beforehand, it was tricky to get full consensus and activation on some of these issues. And there were some bills that, I'm happy to talk about later on that talked about the uses of emerging technologies and artificial intelligence in decision making in healthcare and insurance claims and attempts to outlaw that. Right. So we were one of the first organizations to engage with that issue. And my background working with state policymakers, I knew immediately, okay, we read this bill, there's a problem. Let's talk to a few folks, but at the end of the day, I'm calling the bill sponsor. I need to have this conversation to share our perspective first. And a lot of times, a lot of advocates will wait for momentum before they engage, especially around healthcare. And I think with the overturning of Chevron, more advocacy organizations have to be more proactive. And so that has definitely shifted, well, not really shifted the work that we do. I think we've taken this position of it never hurts to have that conversation. You see something that you're not entirely sure how this will impact all of the various stakeholders, you get on a call and have that conversation as soon as you can to learn more about it instead of making assumptions. And
Yeah.
so I think it's forcing everyone else. And I have to toot our own horn. It's forcing more advocacy organizations to operate at the speed that we operate at.
Yeah, so one of the things that is, we are the 50 United States, but healthcare is one of those industries that acts still as 50 independent states. It's in many degrees, right? So Brian, you were right at the top of when you said, Medicare, largest payer in the country, but then each individual state operates slightly differently, right? Just in the provider credentialing, there's just a lot of heavy regulatory constraints that is one state you can't do synchronous telehealth, the other state you can. There's just no uniformity across the states. And you had the compact, but only so many states joined the compact. Again, from a policy perspective in how we deliver care, it just seems like both the state and the federal government can do a lot better relative to coordinating across the board as opposed to having separate and distinct policies on how to deliver care.
Oh, I couldn't agree more. Yeah, I absolutely couldn't agree more. Something to add too, if I could, on the recent court decision too, is I just at the federal level, and I do actually think this so much that the later effect will certainly, the ripple will reach states. I guess I can tell you what I mean by that in a second, but the decision to me, the decision means that agencies will now enjoy far less flexibility and leeway in how they enact congressional language. So, and Congress knows that, I think. So Congress, when they write bills, are going to need to be way more specific. And then the agencies are going to have to really watch their P's and Q's, or mind their P's and Q's, I guess, more than they previously did under the Chevron doctrine, where where an agency could enjoy basically some pretty strong deference that as long as what it was doing was not arbitrary and capricious to the intent of the statute, then usually it was okay. Now they're basically looking at a reasonableness standard, and courts are, as you say, courts are going to have a way more pronounced role. I think what that will translate to add on to what Caleb was talking about a little bit, is some added difficulty in getting language passed by Congress, should they act. And less action, probably, from agencies writ large, at least in the near term, until case law settles and there's some more clarity around the standard. But that's all going to be tested over the years. It's going to take time. Yeah. That inaction.
Are you saying we no longer have to pass the bill to find out what's in it?
Yeah. Right. Yeah.
So let's pause here. As the audience may not know, this is a two-part series, and this brings us to the end of part one. And the next program will be part two. So let's pause here. Brian and Caleb, I want to thank you for participating in part one, and we'll reconnect on part two shortly.
Thank you.
Thanks for having us.
That's today's shift. I appreciate the audience taking the time to tune in. If you missed part of today's episode, you can tune back in at the healthcarenowradio.com at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. And be sure to check out the program page at thevirtualshift.co. As well, remember to follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, TheVirtualShift. I'm Tom Foley. Until the next shift.